And good evening, everyone. What's going on? This is Gordon, and this is going to be a more detailed video on what's it like to have keratoconus. I'm going to open up a window over here on, well, my left. It's probably going to show up as your right. And yeah, so then that way I can make sure that I'm saying relevant or correct information. So keratoconus is a rare disorder, condition of the eye. Can happen in one eye or both eyes. For me, it happened in both eyes, and it actually is worse in this eye, which is my left. So let's see. Let me just look this up real quick. All right, so yeah, about 200,000 cases a year on average, and I didn't really find out about it until probably my mid-20s, around 24, 25-ish. That's when I found out that I had keratoconus. I was diagnosed with it. I noticed the symptoms pretty early on, around 17, 18. I started noticing that, especially my left eye, would blur out every now and then. It would get a little better, but it was blurrier than my right eye. And I'm like, okay, maybe I'm just tired because I wasn't sleeping very good. I had insomnia. Some days I would, well, not some days, but sometimes I'd be up for about, 3 days, 2 days. So like, minimum of 36 hours. And that's not good for anybody. And I also was like a chronic eye rubber. So, take off my glasses and start rubbing my eyes and all that stuff. Not good. Don't do that. If you have keratoconus or you think you do, don't rub your eyes. I'm serious. Don't do it. Another thing with keratoconus is they believe that it's a weakening of the middle of the cornea. So you have multiple layers of your cornea. And so it's a weakening of it, and in compensation for this weakening, it starts building this kind of dome thing that happens. So it starts stacking, and it bends light and bends your vision. So you start getting blurred vision because your lens is being altered. Another thing that can happen is it can stretch out like glare. So when I look at lights, it just goes everywhere. Whoops, didn't mean to touch that. Stay. So let's say this is a light source. It starts going like that in like 4 different directions. I pretty much see roughly 4 or 5 of everything, which is a little annoying. Just slightly annoying, just a little bit. But yeah, so let's get into it. So they don't really know too much about keratoconus. I went to Dr. Edward Manji down in Stanford. He was one of the few people that could do a cross-linking procedure. Let me get that window up for cross-linking so I can explain it better for you guys. Excuse the typing. Okay. There we go. Okay, so it says here that cross-linking is a minimally invasive outpatient procedure for the treatment of progressive keratoconus. FDA-approved cross-linking combines the use of prescription eye drops, Photrexa, I believe that's viscous, so it's riboflavin, 5, so like B5, and phosphate, and 20% dextran, ophthalmic. I'm really bad at saying that. So, anyways, they use a ultraviolet UVA light, and what it does is it creates new collagen threads. So you have these little collagen threads that help keep your eye, your cornea stable. And with keratoconus, that starts weakening. Those bonds are not as strong. That weave is not as good. So you start missing some of the pieces. So then it's kind of like this instead of this. And then it happens enough, and well, that's not good. Your eyes will start compensating and, doing all kinds of crazy stuff to, try and make sure that it doesn't progress further. But if anything, that actually makes it progress worse. So it's a weakening of collagen. And so what you want to do is, if you do have keratoconus, see if you can apply or you're able to have cross-linking surgery. Well, non-invasive surgery, the procedure. And take collagen peptides I take collagen peptides. I also take some eye supplements and things like that. I make sure that if I have dry eyes due to allergies, I take eye drops. So there's a few things. I'll put them down in the description below for you that you can do, and that will hopefully, just reduce the kind of the natural degradation. Now, some patients have very successful keratoconus healing, from cross-linking. So sometimes, the lens starts kind of going back to normal, right? So instead of being like this huge kind of misshapen dome, it kind of starts tightening up and, coming back a little bit. And so you have this firming of your cornea. It can be painful. So for me, when I had the procedure done, they do one eye at a time. And it's about an hour or so. So they put a speculum in your eye and, the tape and everything to keep your eye from blinking. So it's like, so that's not, I don't like anything going near my eyes. I don't like eye drops. I don't like the little pressure sensors. I don't like any of that kind of stuff. It sucks, but it was worth it. I'm glad I did it when I did, and I'm glad that my insurance paid for it. I have Molina, and yeah, so it was a tough day. So one thing I do recommend, if you do have keratoconus and you get cross-linking done, have someone else drive for you. That's required. You need someone else to drive for you, or an Uber, anything, a family friend, anyone. I highly recommend that, because you're not going to be driving. If anything, they won't do the procedure unless you have a driver. Another thing is, like I said, take collagen peptides. You can find them on Amazon. I'll put a link in the description for my personal favorite, Evolution Supplements. They make a collagen peptide, and personally, it's been really awesome. I noticed that my eczema has cleared up a bit. I still have, acne. You can see that going on. I've had acne pretty much my whole life. I'm 28. I'm turning 29, and it really hasn't gone away. I guess I'm in a perpetual state of puberty. Anyways, so back to the point. So you have this keratoconus condition. Now, they don't really, again, kind of back to the main point, they don't really know the causes. They do know that there's some predisposition, genetic stuff that happens at childbirth. It can be passed down. So be aware that if you do have keratoconus, or someone in your family has keratoconus, like a parent, mother, father, or even a grandparent, the likelihood of you potentially developing it in life is, the potential's there. So I would recommend keeping an eye out. If your eyes start blurring, or you start noticing, a difference in your vision, the light is stretching. So instead of like looking at the moon and you see the moon, you look at the moon and you see like a bunch of blurring kind of drama going on, or even slightly like instead of like one, it's like this. You see that shift, that kind of double vision thing. That's kind of like what it's like for me. But instead of like a singular shift, it's kind of like a weird loopy kind of thing. And then it even goes upwards too. So it's like up, down, down again, and like a little bit in the middle. So I see like, it doesn't even look like a moon anymore. It looks like a weird art project that someone failed. Probably me. Yeah, so it's a little crazy. Let's see. Let's go back. It's okay. Yeah, loss of collagen in the cornea. Can it be cured? No. There is no cure for keratoconus. Now, cross-linking can potentially stabilize things. Your collagen threads, produce more collagen sites in your eyes, and that chain reaction can stabilize it. Sometimes it can lock down the condition so it doesn't progress anymore in your life. That is fantastic. If you can have that happen, seriously, I really hope that happens for you. If you have keratoconus and you're getting cross-linking done, I hope the best and that it doesn't progress anymore. Do not rub your eyes. If you have cat allergies or anything like that, be sure to take your allergy medication and that kind of stuff. My biggest recommendation is I love cats. I love animals. It's a tough thing. So it's like one of those things to where, do you want a pet, or do you want to increase the chances of you losing your vision or not just increasing chances, but to where you're going to have a faster progression of keratoconus. And so that's a tough decision. No one wants to make that decision. So if you already have pets, and I mean, honestly, I don't recommend getting rid of them. If you don't have pets, don't get any, or get ones that you're not allergic to, and don't irritate your eyes. Allergy season. So if you're allergic to pollens like I am, and animals and things, take your allergy medicine. Get some eye drops. I think I have a bottle of them around here somewhere. Yes? No? No? No. No. Okay. I misplaced them. Good job, Gordon. So, so you want to have eye drops. You want to keep your eyes hydrated. You do not want them to get dehydrated and all upset and everything, and that's not good. Any more that I can use to discuss this? Let's see. Does it get worse with age? Okay, so I don't really trust this thing right here. It's cedarssinai.org. It's talking about that it can often start in puberty and get worse until about age 40. Well, I know people I've talked to people who are in their 70s or 60s that have keratoconus and actually developed it later in life instead of earlier. And it's progressing. And, so I would take that information with a grain of salt. That's right here. I just found it on Google, so that's not exactly good. Let's see if I can find another question. Is keratoconus a big deal? Okay, so apparently it's referred to as KC. I didn't know that. It is a progressive eye condition. So the cornea weakens over time, and usually when it's typically round, and this is, like I said, you develop those atypical mounds and irregularities, these kind of bulges that happen, and it affects your vision. So yes, it is a progressive thing, and it is lifelong. Let's see. It does not go away on its own. Severe cases, you're going to need a cornea transplant. So keep that in mind. Let's see. Is keratoconus surgery painful? You shouldn't feel any pain because your eyes will be numb. The entire treatment takes about 60 to 90 minutes. That's the cross-linking. So yeah, I was right. It was about an hour for the procedure. I was remembering that right. Okay, good. Can it be cured naturally? No, it does not fade on its own, and the shape of your cornea can't permanently change on its own without surgery or, external procedures. So it is a chronic, lifelong disorder. So once you got it, you got it. And does rubbing eyes cause keratoconus? Is the main factor of major? Okay, well, eye rubbing can give you keratoconus, not especially but it's just one of those things to where if you have a habit of doing it, stop it. It's like biting your nails. Stop it. Don't do that. So even if you're not predisposed to having keratoconus, you could potentially put your cornea in a state to where you're weakening it because you're agitating it. You're irritating it. So don't rub your eyes. I mean, I do it in the shower to where, oops, did that again. Kind of like a squeegee. So I do the one, boom, like that to kind of clear my eyes. And that's about it. Okay, I'm not really seeing too much stuff going on here. So you can get stigmatisms, double vision, inability to see in dim light. So that's another thing. You can probably see my mag light right there. That thing is 2,500 lumens. So it's pretty bright. And sometimes I need it because flashlights are just not that good. And I had eagle eye night vision when I was a kid, and now I do not have it. So it's it can be exhausting. Now, as for what I can do with my mental state or kind of my state of mind, is knowing that I'm doing the best that I can to make sure that I'm being aware of my progressive disorder. And doing things, that just implement a better lifestyle or preventative type of actions. So no eye rubbing or very limited eye rubbing to where you're in the shower. Oh, excuse me. knowing you're just wiping your eyes once or twice or something. In the pool, same thing. If anything, I wouldn't open your eyes underwater because of the chlorine and irritants and that kind of stuff. I mean, there's all kinds of stuff in pools. Like, wear goggles. Seriously, just wear goggles. Ocean, same thing, wear goggles. Let's see, what are some other things that I can recommend other than the collagen peptides and eye drops and allergy medicines? And yeah, so preventative measures, no rubbing your eyes. No, don't put yourself in situations to where your eyes get agitated either through allergens or chemical exposure. So you want to be careful with that. Another thing is, you want to stay hydrated. So it's not just your eye drops. Stay hydrated. Drink lots of water. Drink about a gallon of water a day. I know it sounds exhausting. It is. But I highly recommend that. Make sure that you're taking, like, there's something like Ocuvite. It's vitamins, vitamin E and all kinds of other things. Assortments of minerals and other stuff to make sure that your eyes have, the optimal things to keep them healthy. Omegas. Make sure you're taking omegas. And don't go out in the sunlight, without sunglasses, or these glasses tint, but that's still not really a good thing. They're transition lenses. So I would prefer having sunglasses. Yeah, I probably should have written down a list so I was more organized and didn't make this video so darn long, but I will put pretty much the TLDR down in the comment, well, not the comments, but the description for you. So if you're interested in just having a short version, I'm definitely gonna mention that first, in the comments, like, or in the description, like, hey, if you want the TLDR, here's the gist of it. And so you don't have to watch a almost 20-minute video. And if you want to watch the video, cool, that's awesome. And yeah, so I will also list certain things down in the description as well, like Edward Manchi's contact information. So if you're in California or you're looking for someone who can do this procedure, cross-linking, give them a call or contact a staff and see what they can do for you and see if your insurance can, pay for it. So talk to your insurance provider and see what can happen. You'll most likely be diagnosed by I believe it's an ophthalmologist or optometrist. Well, I'm always getting those mixed up. Don't quote me. But yeah. So again, if you have keratoconus, just be sure to be careful. Limit your exposure to irritants. Have some lifestyle habits that you implement that are going to reduce your chances of making it worse. And if you have cross-linking done, that's going to slow down the progression. It may halt it entirely, but it is a progressive disorder naturally. So it's one of those things to where it's like, okay, take your supplements, take your collagen peptides, take your eye drops, focus on your health, focus on those things and your lifestyle choices, and you should be able to keep your eyes in check. Now, worst case scenario, you need a cornea transplant. Okay, I don't know anything about that because I haven't gotten to the stage where I need a cornea transplant. But my vision is pretty sucky. So, especially if I don't wear my glasses, I'm not going to recognize anyone unless they're like right in my face. So, yeah. Well, thank you for staying throughout the whole video. And if you've been skipping through it, thank you for taking the time, to check this out. And I hope that there's some information here or in the description that can give you some tips on what you can do to lower your chances. And if you're just curious about keratoconus, thank you for stopping by and learning about it. I'm not a doctor or anything, so I didn't really give too much information, but I'm someone who suffers from it, and it is definitely interesting to hear someone's opinion and experiences, through this condition and other conditions. So again, thank you for the time. Thank you for your sacrifice and being here, and I appreciate your love, your support, and all that good stuff. So leave a comment if this has helped you, and if you have any suggestions on what I can do to maybe answer some more questions, something that I haven't brought up, paste it in the comments, and I'll get back to you at the soonest that I can, because I am a little busy, and sometimes I don't notice things immediately, so forgive me if I take a week or I take a few days or sometimes a few hours just to respond to you. So nothing personal. I'm, trying to catch up on a bunch of things. So much love, everybody. Stay safe out there and take care of yourselves. Bye bye.